El Paso is in the gray, Dallas is orange, and Bexar County is in this lighter color blue, which is sitting just above us. So you can see there's certainly been variations in patterns over time. You can see that this was our surge that we faced back in June and July here in Travis County, and we have since come down, and our active cases per 100,000 population is about 115 as of Friday. That is compared to El Paso, who as of Friday had more than 4,000 active cases per 100,000. In fact, El Paso has almost as many active cases right now as Travis County has had total cases throughout this pandemic. You can see similarly that Lubbock County is facing a significant surge, which far exceeds what we faced in our previous surge. What we're trying to prevent is this El Paso pattern from happening here. If we were to let this go to this extent, we're talking about needing more than 600 ICU beds and more than 2,400 hospital beds, which is about triple what we think we actually have.
Dr. Escott, can I interrupt you for a question?
Yes.
What do you know stat-wise of COVID in Mexico? Because you're really trying to figure out what is going on in El Paso. I mean, do you get to keep up with that? Are the numbers tremendous in Mexico?
Commissioner, I have not tracked closely the activity in Mexico. I will say that certainly the proximity to the border may be a factor in El Paso.
Yeah.
There's also variations in compliance across communities with things like masking and social distancing. There are some communities who are more resistant, in particular, to the masking piece. There are some communities where the public messaging between elected officials is more controversial. And I think all those factors certainly come into play when we look at what's happening there. But El Paso is an absolute disaster right now.
Yeah.
We've received a little more than a dozen patients here from El Paso. They tried to send more, but many of those patients died before they could be transferred. El Paso is in a situation now where they have 10 refrigerated trucks to store bodies. Because we expect over the next couple of weeks that their death count is going to skyrocket. There are conversations right now about how other jurisdictions can support the excessive deaths because their local facilities simply can't manage processing that number of bodies. We are talking about a real catastrophe here, not only in El Paso and in other jurisdictions in Texas, but across the country. This is the nightmare scenario, and we are facing it right now. And if we don't act right now, then Travis County and other jurisdictions across Texas can be in a similar circumstance to what El Paso is facing right now. And we've got to work hard to avoid that.